So beyond addictions, insight into substance abuse and recovery. So what I thought instead of only talking about addictions, so we'll go like what is mean by addiction, substances, types, then process of recovery, and what is mean by recovery, and what are the how to identify the drugs abuse. This will be the flow of my session. Yeah. So next slides. So next slide, sir. And Jenny, sir, next slide.
Yes, just a minute. It's taking time. I don't know why.
Yeah, yeah, yeah. It's okay. And addiction is always having the scope from the beginning. It will be there up to I think lifetime. So we used to always say there is there are 4 5 fields always having scope. We can intervention giving more intervention to the people. One is children, one is women, and geriatric population, and one is addiction. Okay, because that the prevalence is higher compared than the olden days. Yeah. So what is substance? So any substances which is affecting my mood or which is altering my mood or body functions, so that made me to become a habitude or it becoming addictive called as a substance. Just generally, I have mentioned that people generally use substance because the way like they want to show it, the substance will help them to how they want to be become. So in that way, it is kind of consumed regularly. And next slide. It's, yeah. So some of the terminologies what we used to in the addiction fielding is one is substance. It refers to the drugs or medications or toxins. So the potential of drug abuse. Use it may be a drinks or swallows, smokes. It's kind of mode of taking substances and drug misuse is so occasionally inappropriate or unintentional. That is the main thing you need to listen. Unintentionally, if I'm taking some particular medicine without doctor's advice or for my happiness, that causes use. So abuse is so purposefully I'm taking intoxicating the particular substance for my own satisfaction or the happiness called abuse. So dependence is I'm using still I can feel all the consequences what I'm facing even though I'm unable to stop that substance.
Sorry, your voice is not audible.
Sir, like now, yeah, now it's audible, sir.
Yes, sir, it's fine. You can carry on.
Sir? Yeah, yeah. So drugs of abuse, it is a chemicals which act on brain and it is influencing. It may be my thinking or perceptions, feelings or emotions, behaviors. It may be a individually or coordination of all these functions. So that is called as a drug of abuse. So in the simple term, what I mentioned is it's a non-medical use of chemical substances in order to achieve alteration in the psychological functioning. So has been termed as a substance abuse. Okay. So when we are diagnosing the patients or clients with substance abuse, or so we need to have clear idea whether the patient is abusing the substance or he's dependent to the particular substance or he's just misusing the because when you are writing in the documentation it should be properly mentioned. So you should know the basic difference between all these concepts. So otherwise it will become like a misinterpretation all these terms. Yeah. Next slide. Yeah. So basically, we can divide into three kinds of drugs abuse. So one is illicit, which is legally allowed. For example, alcohol, tobacco are legally allowed. Okay. Illicit means, for example, cannabis or other high level of substances, illicit. And third one is prescribed drugs. It will be, for example, we used to say in the clinical settings, if the patient is coming and reporting, sir, I'm having severe pain for like more than 10 days. So we prescribe painkiller. Okay. So it is only for 10 days. They should stop within a 10 days. The patient used to, once 10 days got to know, so the patient used to collect same prescription with other medical shops. Okay. So with the same prescription, or they will take the photo in the WhatsApp and they will show to the medical shop, sir, I want this medicine, sir, I missed my prescription there. So that is also called as prescribed drugs. And patterns of drug use is, so abstinence means the person is completely away from the any substances. Okay, it's called as a abstinence. So, for example, we are treating the patient. So 1 year, the patient is not at all because of the treatment or intervention. 1 year, he is not taking any substance for 1 year. Okay, so we can call him as a is abstinence. Since if it is 3, 4 to 6 months, so he is abstinent since 6 months. Since 1 year, we need to mention. So social use, I think all these four types of pattern of use I will explain in the further slides. So next slide. Yeah. So social use drinking, it's a casual drinking settings without an intent to get drunk or intoxicated. So nowadays it became like quite common in the IT industries and all and the working culture. So sometimes like if I'm joining the new job, I need to give us a treat, or if I'm going for any functions. So to get the peer pressure, to get peer support or approval from the group where I'm working, I need to take for the name check at least I need to take 30 ml of alcohol or at least beer or wine. Okay, to get the approval from them. So that is called as a. So I don't have any intention to drink. So just the situation made me to drink. That is also very next one. And we all know that nobody addicted in the initial phases. Okay, so everybody will use like occasional use, and first use of substances 99% it will be not from our own pocket. It will be from the friends or the relatives or the colleagues. Will be the first person who will sponsor for our substances kind of initiation. Okay, that is how the social drink starts. Then it becomes the hazardous use. So here hazardous use, so risk of harmful consequences. So it may include a physical health problems, mental health issues, social problems, relationship, work or community. So risky substance use that may cause harm later. Okay, now may not be much harms, but there will. So there we can say it's a hazardous use. Okay, so this is the second level. So first level is social drinking, second level is hazardous level of substance use. Yeah. So next slide. Then it comes to the harmful use. So once a hazardous use crossing the limits, okay, already damaging to my health. It may be a physical health or mental health or social dimension health. Okay, and often leads to the social problems to family, work, and relationship. And harmful use that already caused health or social damages. So hazardous was not much damages, but in the harmful directly we can see there are so much of damages in the all these dimension because of the substance abuse. Yeah, next slides. Here we can say who is called as a dependence. So in the if you are working in addiction setting or mental health setting, we never used to say is addict. addicted to the substance abuse. If it is a professional, okay, in a professional way, we need to always say his dependence, depending on the tobacco, dependence of alcohol, all particular substances. So we should not label them as a addict, since it is a illness. We have to always say it's a dependence. So it is a when I can say he is dependent to the particular. So it's a cluster of behavioral, cognitive, and physiological that may develop after repeated substance abuse. Okay. Next slide. So we used to always two kinds of diagnostic criteria we are following. One is ICD, International Classification of Diseases, and in that F category will be talks about the mental health and addictions. Okay, zero and DSM, Diagnostic Statistical Manual of Disorder. It talks about that is also one criteria. It is mainly used by the American countries and all American Psychological Association. Like they have the association, they used to follow the DSM. And but worldwide, usually we used to follow ICD. So in that we have given 11 symptoms. So larger quantity. So when if it is a social drinking, I will finish my drink with only one beer or only 30 ml of alcohol. Okay. So once I become dependent, my quantity will be increasing. So automatically 30 ml leads to 1/4 or 2/4. And persistent desire, which means I am always having the craving to use particular substances. So for example, if I am addicted to this, now I am in the session. So now also I will have the craving to have at least can I have one pick? Or I used to think that by this time I could have taken some beer or I can have session with the substance. Okay, so always thinking about the particular substances once I become dependence. And third one is salience. Fourth one is craving. Yeah, always craving. And salience is nothing but it's kind of instead of for substances I ready to lose anything. If it is a family or financial anything, I don't want. If it is only for I give more priority to the substance rather than family or my own health. Yeah, and inability to fulfill the major role obligation because of my substance abuses and continuous use despite having persistent recurrent social interpersonal problems and reduced important meaningful activities and even I'm getting any kind of physical or mental damages and use. I know that it is harming my health, but still I want to use, I will use. And tolerance is full kick with 30 ml of alcohol. Okay. So within 2-3 months in the 30 ml, so I need to increase my level of quantity to get the kick, the tolerance. So that is one of the important criteria for addiction. And withdrawal symptoms. So we all know that withdrawal symptoms is very common if it is dependence. So it may be a seizure, tremors based on the substances, tremors, seizure, and anxiety, sweating, sometimes bleeding, or blood vomiting also will be there. Some patient may have a hallucinations also, psychotic symptoms also will be there. Uh, all these kind of withdrawal symptoms we can see within 12 hours to 24 hours. On this day, it is whether he is a dependent to the particular substances or not. So out of 11, at least 2 need to be present in the last 12 months to diagnose for he is a dependence to the particular substances. Yeah. Next slide. So what are the risks of use substances? So yeah. So individual level and family, community level and other factors. So individual level. So when you are seeing the client, that's why in the MSc and KCC we used to always correct the pre-morbid personality and history and also that will help us uh, to know the personality of the clients also. So here history of early childhood negative and aggressive behavior. So these and all studies shows there is a high relevant. The child is having very aggressive behavior means in the future the child may take substances. Okay, and history of physical and sexual abuses. So if you're going to the observation homes in that children in conflict, no. So most of the children used to say, "Sir, we got abused by our own family members, relatives, friends." So they are highly vulnerable to use the substances also. So it is high, and the children is who is having or person is having emotional, social, academic difficulties also high risk to substances, poor and unstable emotions, mental illness, and thrill-seeking behaviors. It is highly common in, I think, urban settings, especially in the higher socioeconomic status. So, like, sir, I want to exposure, I want to get the curiosity, I want to experience this, how it will be. Okay, so that also risk factors, and many of the people they may not know the consequences of the substances also. Now they are putting advertisement in before starting any movies about the tobacco use, and if it is anything related to the substance, they are putting in the line. Most of the people they are not aware about the consequences of. So whenever we used to conduct some kind of awareness program after the feedback session, no? So they used to come and say that, sir, I thought alcohol is will help us to improve our sexual functioning, sir. But fact that that is not at all real, sir. So alcohol is so it is that you have mentioned in that person. So most of the people they are not aware about the consequences of the substances and level of education important in the substances. Yeah. So next. Yeah. So one of the major risk factors poor or inadequate parental supervision. So they are the one highly vulnerable to use all the anti-social activities also. So if the parenting pattern is good in any family, you know, predict the children's like these children will be uh, future will be good, high scope, and they can shine in the field and all. If it is a poor and inadequate, leads to the this kind of antisocial elements and poor communications within the family and family tension and conflict within the family members and severe parental discipline also leads to the history of alcohol is highly connected to the because the parents are the one role model to the children. So whenever they are observing that parental behavior, also automatically we are insisting the behavior into the child's mind. So they are automatically following what the father and mother is doing in the family. Yeah. Next slide. So other risk factors, low socioeconomy is highly connected to the substance abuses and living in a high crime and drug use neighborhood is also the vulnerable factors and drug availability also one of the reason. Okay. And peer group pressure if it is adult or adults in age, peer group pressure is the factors to initiate the substances. Yeah. Next slide. And here what as a any yeah. So we need to notify the see mostly in the parental session, no, they used to always say, sir, we never thought that my son or my daughter will use this kind of substances, sir. Still we cannot believe, sir. So kindly help us how to identify whether my substances. So what are the symptoms we can notice in the family setup. So so we can list out. So that is also one of the important skill we need to know so that we can ask the clients whenever in the especially in the mental clinic or OPD, we need to rule out always the substance abuse history. because patient may not come and say, sir, I'm having this many years of substances also, sir. They tell lie also. Sir, no, sir, I never touched alcohol or tobacco, sir. So we should have the skill substance abuse. At least we need to guess based on the behavior. So one is a sudden change in the behavior, in the mannerism, and frequent changes of friends, especially in the schools and colleges. So as a parent, as a brother, you need to also aware with who is he is having kind of friendship circle. We need to always aware that. Anger and unsatisfactory explanation and withdrawn behavior, especially in social gatherings or any festivals, deplaced and not focused, multiple theft or missing personal items, and neglect or personal hygiene, unusual dress habits also, the symptoms of the drug abuse. He was sharing with me. I think he was on some 17, 18 years. So he used to abuse some kind of tablets. They will be costly. It is only available in the medical shop. So whenever he doesn't have money, he used to steal the home. Once what he has done, under the intoxication of that particular tablet. So I think around 11 o'clock he was walking the street, and opposite the person was walking, and he was just to make a kind of warning saying that if you are not giving your mobile or money, I was 18-year boy, and he is 35 to 40 years old, because under intoxicated one thing, and he is urged to use the tablets. He wants the money. So if even we are also, if we are addicted to particular thing, we always find a reason. We need to like always see the root how we can get the money, how we can do the things. Okay. So in that way, people is always preoccupied with the substances once they are become dependent to the particular substances. Yeah. Next slide, sir. And yeah, what is we can show the behavior like disrespecting the authority figures, and strong resistance to the parental caution and corrections, and they are always violating the privacy, and staying out, like frequently coming to the home very late, and violent behavior, and sense of vulnerability, and emotionally unstable, lack of motivation to do work, slurred speech, and if you're seeing the eyes, it will be like a short eyes when I use, and pupillary dilations. Okay. So these are all the effects of substances. This will also help us to identify the person is using any substances and all. It helps us to understand the client better way if we know all these kind of signs and symptoms of the substance use. Yeah. Next slide. In terms of issues that I think, and weight loss will be there always with the substances. Not may not be with in particular substances. There will be always weight loss or way overweight will be there. And wear long sleeved clothes because to marks and all. Unusual drowsiness, fatigue, and constant tiredness will be there. And possession of drug will be always with them. If you are, when the children is not packed, no, so they will have this kind of substance anywhere near to the home, within their get. If you're checking unexpected, no, you can always get the substances. Yeah. Next slide. So next slide. Yeah. So first what are the strategies that we are working national wise or internationally for the substance abuse? So always we are following three strategies. One is supply reduction. So it is mainly focusing the limiting the availability. Uh, so once the drugs are not available everywhere, so automatically the expected to use of the drug abuse will be reduced. See, for example, when we are in a small age, so we rarely sing the shop. Okay, so for taking alcohol, I need to go at least 10 kilometers, 20 kilometers to get the alcohol. Okay, so one is supply reduction. Okay, then second one is demand reduction. So its main aim is to decrease the desire for the drugs. So that is what the prevention level or educating about the substance abuses and early identification and rehab addiction. So if you're taking in tobacco, cigarettes, packets, and all, no, there'll be a helpline number will be there. So that and all demand reductions and harm reductions. If the person is too much addicted to the particular substances, they may not be able to cut down immediately. So for that kind of patient, harm reduction will be useful. So minimize the negative sense. It's a pragmatic option. And again, even without necessarily stopping it. So for example, some of the metabolism may not be able to stop immediately even with the medicine also. So for the reduce harm reductions will be there. Like you can take, it won't harm much. So harm will be very less. Provision of the medical professionals can be given in the rare cases also. So these are the three strategies. So major challenges it is political also involved. So even though we have so many policies, laws also there, the benefits of the government and party wise, very difficult things in the community. Is it possible to reduce from 10,000 wines up to 1,000 or 5,000? It's a question mark. Depends on the state, party, so many other things also involved. People cooperations, so many other things are involved. And I have removed the consequences of substance abuse slides purposely because we know, because everybody is victim. We know our own family or neighbor affected. We know the consequences. Okay, individual level, how it is affecting the health, physical health, mental health, socially, and how many people have lost the life, lost the family because of substances. So there is infinity consequences. Okay. So it is very difficult to say all the consequences this way. So you know already the consequences. So I just mentioned some of the three major things. One is life-changing complications. One is addicted to drug abuse, more like infectious disease such as HIV, hepatitis, because under the influence of uh, so highly vulnerable to have unprotected sex or changing the injection and using the same materials and all. So there is also communicable diseases are highly chances when you become dependent and accidents. So since I'm working in Zipmar, So what they used to say is like, suppose you just imagine, so 7 people are addicted to alcohol. So they form a meeting in that particular community or in the particular home or de-addiction center. So client used to start to sharing their experiences with the substance abuse, negative experiences. So for example, I am Raghu. I am addicted to alcohol. I am alcoholic addicted. So I started in the age of 29. So I started with a beer. So within 6 months, I got become a brandy, whiskey. So now I lost my family. So they are distant me outside. So I don't have any place to stay. I lost all my financial support. I lost all my friends, everybody. I lost. Now I'm here. I lost everything because of substances. So like this. So common sharings will be happening in that particular alcoholic anonymous group. So that is the one of the best self-help group to help them to come out of the addiction. So next slides. And this is the very important thing. So if you are treating the any client or any person, so these 5 things always you should have in mind. Okay, it is basically based on the motivation level of the client. So 5 stage, you just I'll give the example. Just imagine. So first one is pre-contemplation stage. So in the stage, the patient used to say, "Sir, I don't have any drug abuse problem, sir. I'm completely okay with the substances, sir. I can stop whenever I want to stop. I can stop, sir." They will say they never agree that they have the addiction problem. That is called pre-contemplation stage. So what we need to here we need to focus on. We should not argument with the patient. Okay. So we can educate the drug abuse. So we can say, sir, you are taking 10 years of alcohol. Do you think 10 years of alcohol won't affect any parts of your body function, sir? Don't you think it won't affect anything, sir? So by educating them, by asking, questioning them, to encourage them, and we are made them to think the way that they will accept. Yeah, sir. So pre-contemplation to next stage is contemplation. So here they will acknowledge, sir, I'm having problem, but it's not that much. I can I don't need any treatment, sir. I think I can manage. Okay, it's a kind of dilemma, ambivalent stage, and here we can say cost and loss. For example, if you are having substance abuse, what are the benefits you have? What are the things you will lost because of these substances? So based on that, we can make a list. We can show. See, if you are quitting the alcohol, these many benefits you will have. If you are continuing the alcohol, these are the consequences you will have. So we are again made him to think that yeah, it is affecting our health and family, everything. So then preparation. So here patient is agreeing that, sir, you are correct, sir. I am having addiction problems, sir. I think I need a treatment, sir. Oh, he is psychologically prepared to get the treatment from our side. So this is what preparation stage. Is decided to take a treatment. Then action. So he started to taking medicines and he's following the craving management, all the techniques what we taught in the clinic and maintenance. So he's maintaining like absent for 6 months or 1 year with the help of medicines and all. So when you are getting any client, just to see the stage, which stage he belongs to. Currently on which stage he is. So each stage our intervention will change. Okay. So in that way, by motivating the client to do all these steps, automatically he'll be away from the substances. And this is also evidence based and effective intervention for substance abuse. Yeah. So next slides. Yeah. So after this treatment and recovery, so as I told, it's a biopsychosocial. So medically, when the client is getting admitted, first we need to detoxification. So it may take 7 days to 10 days of detoxification with the medicines. I have mentioned some of the basic medicine name. And second one is once he became detoxificated, he is ready for a counseling. We need to ask. assess his motivation level, then counseling starts. Okay. And once we are planning for a discharge and all, community support is we can refer them to. So, for example, we used to have a list of AA groups in the particular community. So, we will refer the patient to the particular AA community. So, we are discharging the patient, sir. So, kindly help you to join your group, sir. So, in that way, community based support also we can refer. And one of the main role is family plays a vital role. So even though I have a willpower, everything, treatment also, family support is very essential. So there were we need to talk about the role of family in maintaining the abstinence, recovery time, how it is difficult for a patient to recover from the substances, do's and don'ts in the time of recovery phases, what are the high risk situations. So all the things we'll educate to the family members also. Yeah. So next slide. And recovery is not like a one-time process, and all. It's a long-term process. It's going beyond treatment. We can say treatment is only for 21 days. Okay, but recovery is a lifetime, long-term. It's needed, and recovery doesn't mean that only away from the substance. It also talks about the positive lifestyle changes, healthy lifestyle changes. And yeah, here absence alone is not enough. So, sir, as per your intervention, I'm away from all the alcohol, sir, but I'm not going to any job. I'm just simply sitting in my home and watching TV. Doesn't mean that it is substance or recovery. Okay. Intervention is to recover the patient. So we need to restore all these unique skills and talents. Yeah. And it requires effort and support. Its responsibility mainly with the client, family, and professionals. And absence is the foundation. So client must be completely avoid alcohol and treat drugs and all. And balanced progress is always crucial. And sometimes once some direction centers. Okay, I think that I will share later. Okay, next slide, sir. And there are 5 pillars of recovery. So one is physical well-being. Okay, so health means it always talks about three major dimensions: physical health, mental health, and social, and not merely absence of any diseases or like. So physical well-being is the main pillar, and productive work routine. Okay, and meaningful relationship, positive personality changes, and experiencing pleasure without drugs. So these are the 5 pillars. So right side I have mentioned the key points. What are the things we need to talk about? What it means. So here the focus area in the 5 pillars. What I need to focus. If it is the client wants to come after the, if it is a proper recovery, these are the 5 areas I need to focus. Yeah. And some of the difficulties, what in the addiction setting, and one is job opportunity. It is always very difficult to get job for the patients who are recovering from the substances. Even though we have referred to the working place, still they may not accept the client because we know that he's a patient, it's a disease, he's completely recovery. But the company admin point of view, they may not take it that much positive way, the client. They may take it in a very wrong way also. That is also one kind of challenges what we are facing, getting the job opportunities. Yeah. The next slides. And so it is also focusing on community level intervention. So even though family is good, the individual is also good. If the community is not good, again having high chances of getting relapse. So in the community level, what are the things I can do? So it's always prevention and the rehabilitation. So prevention level primordial. So prevent risk factors before they develop. So that is why we are saying that school mental program, one of the main components is substance abuse. So whenever we are going to the school, no, I think last uh, last year I went to a higher secondary school. It was ninth and 10th standard. So after the session, two students came to me and asking, "Sir, weekly once I'm taking tin beer, sir. Is it a problem, sir? Will it become? I become addictive, sir." So you just imagine ninth and 10th standard students. This is tin beer, okay. Before that, seventh and sixth and eighth, now they are having kind of other tobacco products in the mention activities. I mean, awareness wise we can do, but implementation wise very difficult. Practically, so much of challenges. And the primary level of prevention is promote healthy lifestyle, prevent substance abuse, and in the smoke-free areas like yellow campaign we used to say. So all the schools we need to follow yellow campaign like within 100 yards that there is no smoking tobacco products are available. So tobacco free zone. So this is the school campus is fully prohibited tobacco products. So all the things we are that and all. I think primary level of prevention and secondary early detection and intervention. So this kind of program will help us to identify the earlier use of substances, and tertiary will be all the final stage of treatment and the rehabilitation will be the tertiary level. In our community, I think tertiary is more common because nobody will come. Sir, I'm using 1 year of alcohol. Kindly admit me and give the treatment. Even family also won't allow. So family is when the family is disturbed, when the family is more damaged because of substance. By that time only, family will bring the patient to the addiction center for the treatment. Yeah. So next slide. And beyond recovery, building a healthy life is always one of the major focus of our intervention. So relapse prevention strategies, it will be changing to the person, and holistic rehabilitation. So providing skill training, employment opportunities, spirituality, and recreation. And role of peer support is also very much needed. And success stories of recovery. In the OPD, what we used to do is if the patient is maintaining 1 year of abstinence, so we call the patient, we'll give the some kind of token positive, for example, medals or certificates or claps from the other patients. So the patient will share the experiences. The 1 year, how was the life changed without substances? How the treatment was effective? How medicine helps me to come out of all the substances? These are all positive stories. So when this kind of stories are shared by the patients, so other patients will connect with their life stories. It will work. It will work, and they will take it as a role model, and they will work on it. Even I think in Tamil Nadu and all, most of the de-addiction centers are running by the uh, people who got recovery from the substances.